And welcome back. Time for one more interview here on Morning Live. Now, 1 in 3 healthcare practitioners have been verbally or physically abused by patients and their relatives since the COVID-19 pandemic started. A body known as the Medical Protection Society has conducted a survey where doctors and nurses shared their experiences and challenges on the front line of fighting the virus. And nearly half of them felt that their mental well-being was worse now than before the pandemic. So to tell us more about this, we're joined on the line by Dr Volker Hitzeroth, who's a medico-legal consultant at the Medical Protection Society. Dr Hitzeroth, thanks so much for your time. Welcome to Morning Live.
Good morning and thank you.
Let's start by just taking a look at the scope of the research and also the methodology that you used in conducting this research.
Thank you. Yes. The Medical Protection Society sent out a survey to a number of its members in South Africa towards the end of October and the beginning of November. And the results have recently returned to me last week. And in fact, the findings that you have mentioned are amongst our most pertinent and important findings and make for some somber and sad reading if we realize that 1 in 3 doctors in South Africa is experiencing verbal and physical abuse by patients or their relatives or indeed members of the public. And the second finding that you also highlighted is that just short of half, 45% of doctors in South Africa have experienced a decline in their own mental and psychological well-being.
Dr. Hitzeroth, was there any indication as to what could perhaps be some of the major frustrations behind this behavior from patients and or their relatives? And one's not trying to make an excuse for it, but did the survey make provision for that to come through?
Indeed. And the results that I've read show that the situation in South Africa and across the world is a difficult one for everybody, patients and doctors alike. But the primary reasons, or the majority of reasons, why doctors were verbally or physically abused seem to be related to the implementation of the disaster management guidelines and regulations. So patients, families and relatives are objecting or at times opposing wearing face masks and facial coverings. They struggle with social distancing and at times object to having to wait for appropriate treatment when higher risk or higher priority cases take precedence. Similarly, when elective surgery is cancelled due to the COVID pandemic, then understandably patients and relatives do get upset. So it's a difficult situation all around for patients and families as well as doctors.
But how have the medical practitioners coped with this? Do they have any sort of recourse when they are attacked, be it verbally or physically?
Well, I think it's very important that any healthcare professional, whether they're a doctor, a nurse, or a paramedic in the emergency services, experiences verbal or physical abuse. Those incidents do need to be reported promptly and in detail to the hospital management or the service management. This information and these incidents need to be collated so that further action can be taken, because we have to remember that the healthcare professionals are actually in the caring profession and they've trained and enjoy helping people in distress. So it is particularly sad when they are on the receiving end of verbal or physical abuse.
Dr. Hitzeroth, are you aware of any healthcare practitioners who have actually laid criminal charges against any of the patients or their relatives who may have abused them?
I'm not aware of that because it was not mentioned in this survey. So I'm not aware of that happening in our sample.
So how are these experiences affecting the mental well-being of the healthcare professionals, especially away from work? One would imagine it would have that immediate impact, but it wouldn't end there. They would take this home with them.
Indeed. And such experiences are extremely stressful to all concerned. So what I've read in the survey is that the healthcare professionals who reported back to us say that they are stressed and distressed, and at times deteriorating into depressive feelings, anxiety feelings, panic-like feelings, and burnout, with burnout presenting with negativity and detachment and disillusionment. And of course, that would spill over into private lives, which invariably means that doctors and other healthcare practitioners struggle to bounce back and continue providing the service and the care that South Africa and patients and families so desperately need during this difficult time.
So in some instances, doctors and nurses were already facing challenges with their working conditions. How much of a role did these issues play in what they are experiencing currently?
Doctors and other healthcare professionals are living in South Africa, and South Africa has numerous socio-political stressors currently live in the country, which are, of course, affecting everybody, including healthcare professionals. Similarly, the healthcare sector has been experiencing strain and stress even before the pandemic, and with the pandemic, this would have only worsened. And understandably, some of the doctors that have responded to us have said they are concerned about their personal safety, their future in South Africa, and of course financial and income worries, which, if we look at some of the reasons, reflect what doctors have said for a while, which is that they are concerned about the health and safety of patients, colleagues, family and friends, just like every other South African. In particular, healthcare professionals now more recently are also concerned about the effect of a second wave, and of course the new way of working, which has had to be implemented very rapidly with remote consulting and various other guidelines that had to be implemented at speed.
So what kind of support is there for these healthcare professionals to help them deal better with the situations that they basically find themselves under, Dr. Hitzeroth?
Well, I think it's very important that healthcare professionals talk about these incidents or about their well-being. This needs to be shared and attention raised for these problems that are experienced across the healthcare sector. There are a number of support organizations. The Medical Protection Society has a free confidential counseling service to its members, but there are others. There's the Healthcare Workers Network, which consists of a number of mental health professionals in South Africa who have dedicated time and care for colleagues in distress. There's the South African Depression and Anxiety Support Group, and there's an organization, Caring for Carers. So overall, I think it's important that healthcare professionals reach out, talk, share, confide, and then if they are impacted and are struggling and need help, make an appointment with a good GP, a psychologist or a psychiatrist, and commit to that first appointment and a discussion about the way forward.
Well, thank you so much, Dr. Volker Hitzeroth, Medico-legal Consultant at the Medical Protection Society, talking to us about challenges faced by healthcare workers since the start of the COVID-19 pandemic and highlighting a very, very important issue for us there. We're going to take a break, and then when we come back, we'll take a look at our poll results and also take a look at some of your responses to our question of the day. All of that after the break.
Our infrastructure build program will focus on social infrastructure. We will focus on critical network infrastructure.
Economic recovery plan for South Africa post-COVID-19. Did you get a sense that this is a plan that would be helpful in any way?
This is just a complete waste of time. It's not going to be done.
Has the president touched on the right elements to grow South Africa's economy?
I'm not optimistic about this infrastructure plan because it doesn't answer a very important issue.
Did it offer you anything of substance?
No, well, we welcome it, Arabella. The question is whether we can afford them, whether they're implementable in an urgent time frame.
Here in Africa, there are people who are using robots in